Earlier this month, it was my pleasure to announce the arrival of 25,350 doses of the Pfizer vaccine to Alberta. And today I have more good news to share, now that the Moderna vaccine has received Health Canada approval. Today, 16,900 doses of Moderna vaccine will arrive in Alberta and will immediately begin immunizing residents at long-term care and designated supportive living facilities. The first shipment will arrive at facilities in Edmonton, Calgary, Red Deer, Medicine Hat, Lethbridge, Grande Prairie, St. Paul, and Fort Saskatchewan. This is exciting news for staff, residents, and families of these facilities who have been on the front lines of our battle with COVID-19 since the spring and who have experienced untold pain and loss. And Minister Shander will expand on our efforts to protect long-term care residents in just a few minutes. Because the Moderna vaccine can be stored at relatively moderate temperatures, it can more easily be transported to these facilities, making it the ideal vaccine to reach our most vulnerable populations. This is in comparison to the Pfizer vaccine that requires ultra-cold temperatures at about minus 80 degrees Celsius, which makes transporting that vaccine to any off-site location very challenging. This news is particularly welcome as we look towards a new year and what we hope will be a turning point in the fight against this pandemic. In fact, by the end of today, Alberta Health Services will have administered over 7,000 doses of vaccines to frontline healthcare workers. I know Albertans are keen to hear more about when the vaccine will be available more broadly, and I want to assure you that we also want to provide you with that certainty as well. But I must ask for patience as we await the first regular shipments of both Pfizer and Moderna vaccines. We are still on track with the phased approach that I outlined earlier in the month. Over the coming weeks, we'll see vaccines continue to be offered to respiratory therapists, to healthcare workers and in intensive care units, to staff in long-term care and designated supportive living facilities, and we'll be expanding our efforts to get vaccine into the hands of healthcare workers in emergency departments. And most importantly, we'll be reaching residents of LTC, that's long-term care, and designated supportive living, regardless of their age. Later this winter, by February, we anticipate rolling the vaccine out to seniors who are 75 years of age and over, no matter where they live, First Nations on reserve and Métis persons on settlements who are 65 or older, and that is because that population is experiencing, unfortunately, significantly worse health outcomes from this virus, and healthcare workers in medical, surgical, and COVID-19 units or operating rooms. As more vaccines arrive, we'll ensure that Albertans who wish to be vaccinated or immunized as quickly as possible when they are eligible can do so. Everyone who wants to receive the COVID-19 vaccine will be able to do so when their turn arrives. Today, there are 14,785 active cases of COVID-19 in Alberta. That number continues to decline as we've had 1,548 recoveries, but 879 new positive tests. That is on just over 11,000 tests for a positivity rate of 7.7%. 890 Albertans are in hospital with COVID-19, of whom 153 are in intensive care. The arrival of the vaccine does not mean that the pandemic is over. And while we have seen progress as the number of active cases has come down by nearly a third over the past 3 weeks, there is still so much more to do, as we can see with 890 Albertans in hospital as a result of COVID-19.